What we know is that patients and families affected by an advanced or metastatic cancer have a predictable and sometimes overwhelming set of challenges to face. How do we manage physical symptoms? How do we talk to our healthcare providers? How do we make treatment decisions? We know that these kinds of cancers affect all of the things that make us feel good about ourselves: our physical appearance, our physical functioning, our ability to work, our personal relationships. And then when time is short, we need to think about how we're going to live our life. How do we make our life meaningful? An important question for all of us, but particularly so when time is short. And finally, how do we face the end? How do we talk about the end of life? How do we plan for the end of life? So these are challenges which occur for all patients and family members affected. There's a lot of distress, but there hasn't been an opportunity in cancer care centers for people to get help with these issues or to have time and space to talk about them. So CALM, which stands for Managing Cancer and Living Meaningfully, is an intervention designed to provide a reflective space and time to talk about these kinds of issues and concerns. We've trained a variety of healthcare providers. We've trained nurses and doctors and social workers and psychiatrists and psychologists to deliver this intervention. And we've done preliminary studies, and now we've just completed a large randomized controlled trial. We've randomized 300 cancer patients recruited from cancer clinics in a cancer center, some to CALM intervention plus usual care, and the others just to usual care. We assessed patients at baseline and at 3 months and at 6 months. And what we found was that there was significant benefit in the CALM group compared to usual care. The primary outcome was depression, depressive symptoms at 3 months. We found that, and also that effect was strengthened at 6 months. But we also found a favorable effect on a variety of other outcomes, including a fear about death and dying, an ability to communicate with healthcare providers, to talk with family members, to plan for the future. All of these things significantly favored the CALM intervention. So we've been very encouraged by this, and we think this kind of intervention ought to be part of standard cancer care. One of the questions that comes up is how generalizable in this. We conducted this randomized control trial in Canada. There is another trial going on in Europe right now, but actually we've trained healthcare providers in more than 20 countries in North America, South America, the Middle East, Asia, Latin America. And what we find is that it's highly generalizable, that caregivers in all of these settings and patients and families are looking for a roadmap, a structure, a map for how to deal with these issues and concerns. This intervention seems to provide it. And now with some support from a global network and global financing, we're looking to establish a global network to support healthcare providers and patients in receiving this intervention.